Hello guys, today we are going to learn about ECG, the electrocardiograph, a graph which is representing the electrical activity of the heart. A graph which is representing the electrical activity of the heart. This is a very important topic from the exam's point of view. So let's learn it very deeply. ECG. This is the definition of ECG. If you will try to learn it like this, you will find it difficult. But if you will try to understand each and every word, this definition become very easy for you. Now, let it break. ECG is a graphical representation. First term, ECG is a graphical representation of an electrical activity. We know that heart produces electrical impulses. So, ECG is a graphical representation of an electrical activity of the heart during a cardiac cycle. Now, we can say ECG is a graphical representation of an electrical activity of the heart during a cardiac cycle. If you will left this term among these three, if you will leave any term, your definition will be wrong. So, these three terms are very important in the definition. Now, the process of ECG. In the process of ECG, there are 6 main leads or the electrodes. 2 we use in the legs, 2 hands and 2 main chest electrodes. This is the ECG machine having a graph which is recording the impulses. Now, let's first learn about these 2 terms, the depolarization and the repolarization. For the learning, D means doing, R means relaxation. So, doing is the phase of excitation, contraction, or we can say the systolic phase of the chamber. Relaxation means repolarization, resting phase, or we can say the diastolic phase of the heart. So, doing, depolarization means excitation, contraction or the systolic phase. Repolarization means resting phase, the relaxation phase, the diastolic phase of the chambers. Learn these terms here only because I am going to use these terms throughout the video. Doing, depolarization, working phase, repolarization, resting or relaxation phase. Now, this is the graphical representation of the electrical activities. Concentrate on 3 main points: the P wave, the QRS complex and the T wave. This graphical representation of the electricity is showing the cardiac cycle also. The P wave represents the arterial contraction. We know the cardiac cycle starts with the arterial contraction. So, this arterial depolarization means the working phase or the doing phase. So, the arterial depolarization means the contraction phase. First cardiac cycle start with the contraction of the artery. So, P is showing the arterial contraction. We know just after arterial contraction what occurs? The contraction in the ventricle occurs. So, just after the arterial contraction, the contraction of the ventricle occurs. QRS complex is showing the contraction in the ventricle. Just after the contraction of the ventricle, what happens? The relaxation phase of the ventricle occurs. So, T is representing the relaxation phase. Now, again see arterial depolarization. Just after arterial depolarization, which is represented by P, comes the QRS complex, the ventricular depolarization, and just after that comes the T point, mean the ventricular repolarization. This is a complete cardiac cycle. Now, this picture is showing a group of 3 things: the impulse initiation, the neuromuscular tissue, the graph and the cardiac cycle represented by the heart. Now let's learn them one by one. First of all, cardiac cycle start with the arterial depolarization or arterial contraction. This is represented by the P wave. We know that cardiac cycle starts with the impulse created by the SA node. So when SA node creates impulse, then arterial contraction start. This is represented by P. Now this impulse is transferred to the QRS complex. This impulse is going. Now it's not in P or not on QRS. It's in between them. So here the artery is in full contraction. Now the SA node is transferring its impulse to the AV node. As it is transferring its impulse to the AV node, contraction in the ventricle start. Here you can see contraction in the ventricle start. So in the graph you can see now impulse is on the QRS complex. Now from QRS complex the impulse will go to the T. What is T? T is the relaxation phase of the ventricle. So after the full contraction of the ventricle, now the impulse is going to the T. Which side? To the relaxation side. So when AV node transfers its impulse to the bundle of his and Purkinje fiber, now contraction, after full contraction, relaxation start. As relaxation start, this graph is representing point T, means the relaxation phase of the cardiac cycle or the chambers, and mainly the relaxation phase of the ventricle. So here we can see full relaxation phase is completed. So now from T it's again coming back to the P point. So like this a graph completes a complete cardiac cycle. Now significance of ECG. We can determine heart rate of an individual. Difference in shape of ECG can determine the possible abnormality or a disease. Generally shape is like this, but any change in this shape like this, or sometime it's one point is missing, from these graphs we can or a doctor can check the abnormality in the ECG or can identify any disease. In this video we have learned about the ECG, the process of ECG and the concept of ECG, and the abnormality we can find out because of ECG. I hope you have liked this video. Thank you.